Well, Dr. Stepovich, we talked about brushing teeth, and as you yourself admitted, you disagree with just about any one of your dental colleagues because they say 45-degree angle, anyway. So, and you say straight, and you say back and forward. They say circular. The rest of it is the same, but there is no rest of it. That is it. That's 100% of the brushing. Shade a little more light on it. Tell us a little more. You also said something interesting to me a minute ago, and that is said that you actually physically show your patients how you brush your teeth with your own mouth, with your own toothbrush, right in front of them in your practice. Are you kidding me or what?
No, I'm telling them to do that, and I'm also telling them that if they bleed when they're brushing, they continue to do that, they'll take 15 years off their life.
Oh, I thought you give them house arrest on the weekend.
Well, if this coming generation is going to live to be 100 years old, they're all going to. If you're bleeding, you're not going to reach 85. So, because today, dentists, that we show that any kind of inflammation that you have in your body, it bothers your heart, your arteries and veins, and your circulatory system. And so, inflammation you want to take care of. And when you have inflammation in your mouth and it's bleeding, you can take the size of your fist and say, that's about the size of your mouth. And here you have this bloody hand. You would never have a bloody hand. You would take care of it. But yet people put up with bloody mouths and bloody brushing, and that's in the middle of their head. And those toxins from that infection that's in their mouth that travel all over their body and damage their kidneys and their liver and their spleen and the hearts and lungs and brain and eyes and everything, and they just deprive themselves of good health by not taking care of their mouths. So I show them how to brush.
Yeah, and since you brought up a slightly different topic, well, not different, but like so related to brushing and about the infection in the mouth, you said that like the average gum disease infection is about the fist or the palm of your hand, and nobody would run around with that much infection, yellow, ugly pus coming out of your hand or feet or wherever. You would go to a doctor right away, but you don't do it in the mouth. And yet, from what I understand, the mouth is the gateway to the blood vessels. Because if you have a medical condition, the doctor tells you, here, take that pill, put it under the tongue so it goes into your blood right away. Right?
That's right. There are many medications that are like that, and the most popular is nitroglycerin.
Right. So whatever it is,
but there are other medications also.
Whatever it is, it goes right to your blood. There's a few vitamins and a few minerals I take, and when I put them under my tongue, I mean, I can feel it how they energize me because they're so fast into the blood. So basically, you have 1 foot for that infection in that mouth, which is big like your hand, pretty much. It has 1 foot to travel to the brain, giving you a stroke, 1 foot to travel to the heart, a couple more, a foot longer down to the liver, to the kidney. And is it true that there are, with no doubt, many pregnant women who have babies which are underweight, premature, and completely linked to gum disease? Because an infection, it doesn't matter whether it occurs in the lungs, in the brain, in your hand, it's an infection and it poisons your blood. And if it's at the gateway of your blood vessels, it just does it a little faster, I think. So is it true that babies getting born deficient in some way?
Well, when a woman becomes pregnant, she develops for the fetus that's growing inside her womb a organ that is only there to grow a child, and it's called the corpus luteum. And the corpus luteum produces hormones that travel all over the body. And if a woman doesn't take care of her mouth well, these hormones cause the gum tissues to really be swollen and get infected. And there is a condition known as pregnancy ulcers in the mouth. And they occur when a woman's pregnant because of these hormones that are running around. So in our system and all around our cells, and particularly in the mouth, if you don't keep it clean, the mouth really gets into trouble. And so there are many stories about how you had to take care of a pregnant woman as a dentist and have them come in to have their teeth cleaned and keep track of them to not let this infection travel all over the body and affect the fetus that's growing within the womb of the woman. Yeah.
Well, that's why they call it an infection, because it infects other parts of whatever's around. In California, where you also live, and so do I, I'm a little more south, so I'm better off than you.
Okay.
There was even a stillborn baby where they found gum disease infection in the placenta of the mom. Now that's a severe incident, but if something like that can happen here and there, if babies can be premature born and other problems can happen, what about the normal everyday immune system for the flu and for that? How much must it affect that? The fatigue,
I think the medical profession is talking a lot about what we're talking about here, about what we need to do to get mothers to have a healthy mouth during their 9 months or so.
I'm telling you, if they're talking about it, they haven't said that a lot to me, because I work with lots of doctors. I would work all kinds of doctors, as you well know, and dentists, and I don't see across the United States of America a single MD referring to a dentist for gum disease. Every dentist complains. Ask 1,000 dentists and say, how many referrals do you get from an MD which told the mom or the dad, because it's the same stuff anyway, except moms get pregnant and dads don't. How many of them tell their patients, go to a dentist, your mouth is having a problem, and because of it you possibly may be fatigued, you may get fibromyalgia, you may have all those things, you might infect your kidneys, and there's nothing I can do if you don't take care of that one infection, because it's an infection and only a dentist can take care of it. I haven't seen it happening.
Well, there are a couple of physicians. I agree that when a patient goes to a physician and the patient asks the physician, says, you know what, when I brush, I'm having a lot of bleeding. And the standard answer from the physician is, that's okay, everybody does. And that's the answer. And so they're not.
He simply doesn't. This is bad. I've thought it to be bad all the time. Because here's the thing. From what you and me are now talking here, which, and this is not something you disagree with your colleagues, because your colleagues totally are disagreeing with that stuff. Now, how not to get it by good brushing, there they seem to be missing something, it looks like, based on you. But they do agree that the gum disease does what you and me are talking. If that's true, with no doubt it is true, then actually, most dentists, again, they make a mistake here. When they talk to the patients about gum disease, not all, but majorly, they talk to them about the tooth loss, which is bad and costs money and all that type of stuff to replace it, and you put a foreign object in it, as we talked about, you know what I mean, instead of straightening out your own teeth, all that stuff. That it's all bad. But the fact is that dentists do good crowns, bridges, good implants. It's not anymore like George Washington, who apparently was wearing a wooden tooth. That must have been a bitch. But, you're making a good work there, but it's the problem, the major problem. This is a cosmetic problem, and it's bad enough. But the major problem seems to be that over 1, 2, 3, 5 years and longer, that this goes on until the teeth are missing. You poisoned your body every single minute. And that is irreparable.